Well, we'll go ahead and get started. It's noon. So call to order the June 22nd Lewis and Clark County Metro Region Opioid Abatement Governance Committee. I'll do roll call. Vice Chair Smith.
Present.
Mayor Dean.
Here.
Commissioner Hunhausen.
Here.
All right, and myself, Wes Feist here. And then we have staff, Eliza and Nancy. All right, we'll go ahead and minutes for the March 30th, 2026 meeting. Are there any comments, questions, or conversation about those meeting minutes? I have one, and just that my last name is a tough one, but if it could be F-E-I-S-T, as much as I hate the spelling myself. Other than that, and that's at 57:27 was the time I saw it. Yes, yeah.
Oh yeah. Oh,
We will revise those.
Thanks. But otherwise, thank you. Appreciate them. I like the succinctness of them and the time stamp on them. Do I have a motion? If there is no conversation, a motion to approve?
So moved.
Okay, Mayor Dean, a second. Commissioner Hunthausen, all those in favor?
Aye.
Thank you. Can you on the computer itself, if you go to the, doesn't give you that.
That's Roman's.
All right. Well, aside from that, we'll go back to the Moat June report. It's attached, no action necessary on this, but for you all to review. Just glad to see that we continue. Region 3 did not have anything. Region 6 or 7 did not have anything. I'm trying to think of, oh no, there is no 6 or 7, excuse me. But nothing from 3 or from a couple of them. So I always am glad to see us, as Lewis and Clark Metro Region, continue to have stuff on here and moving money out the door. Any questions about the report from the June status update? I will take that as a note. All right. Status update on funded projects. And we have the folks here from Good Samaritan. Both of you, correct? I don't remember your name. Maddie. Okay. Were you here before?
Yes.
You were here before. Yes. And you're doing some of the outreach yourself.
Yes.
So we'll go ahead and hear a report since Good Samaritan is here in person. We all have your report, have hopefully, assumingly, read your report, but just looking for a 4-minute if you have anything to add. And then if our group had any questions, we don't always, and so we appreciate you coming, but I think that it's important to give the opportunity to provide some comment and make sure that we are able to answer things. So I'm just gonna do 5 minutes if you all wouldn't mind, and go ahead and begin.
Okay. So over the course of the grant period, we have served a total of 117 unique individuals and provided over 500 services, not including transportation. A large number of these services are simply meeting the basic need of unhoused individuals in our community. When street outreach is out in the community, walking the streets, exploring encampments, and connecting with clients, they often carry hand warmers, socks, emergency food packs, and in the lock zone to hand out as needed. Having something to offer to fill an immediate need offers a point of connection and gives an opportunity to get to know the individuals in our community. These points of connection are essential for building trust between street outreach and the unhoused individuals who more often than not have a hard time trusting anyone to begin with. This trust is the foundation for all our outreach efforts. It allows us to create a meaningful relationship with clients so we can truly hear their stories and refer them to the resources best suited for their needs. Street outreach works to bridge the gap between unhoused individuals and the services they need. One particular way we do this is by providing transportation to and from medical appointments, housing appointments, recovery groups, case management, food sharing, and a weekly shower program. As of May 2026, Street Outreach provided over 900 individual rides to assist in removing the transportation barrier that often hinders the unhoused community from connecting with their goals. Along with meeting a need for transportation and filling basic material needs, we assist individuals in getting forms of identification and often needed to apply for jobs, housing, treatment facilities, and sober living. We accompany our clients to MVD for IDs and the Office of Vital Records for birth certificates and the Social Security Office to replace lost or stolen Social Security cards. Through this grant period, Street Outreach assisted 35 individuals in getting these documents. One of the most meaningful parts of the work is seeing how access and support can create an everlasting change for people we serve. In the past year, we supported 11 clients as they transitioned into long-term housing. We assisted 12 individuals with the application process for treatment centers and supporting them in connecting to sober living after the program. We provided dozens of tents, sleeping bags, and tarps to ensure our clients are warm and out of the elements as much as possible. And we as Street Outreach work to restore the dignity of our clients and support them towards achieving their goals.
Thank you.
Yeah.
Are there any questions from anyone online? Vice Chair Smith or Commissioner Mayer, do you have any questions for the Good Samaritan program?
But I love hearing the data pieces, and hopefully, continue to help folks get onto the path to recovery.
Yeah.
So thank you for everything, but it's very helpful to hear some of those pieces.
Thank you.
Mr. Chair.
Mm-hmm.
Just a little bit about how things are going in terms of your move and all this stuff, and a lot of transition this year as well. So
yeah,
just kind of curious how things are going, how some of the clientele has been able to transition to new space.
I think it was the slow start. Every time we have moved in the past, it was like really hard. Like the first few week or two was really boring because no one's there. And it's like us but it's really picked up, and our location's great. We're right all on the same roof, under the same roof. So it's easier to navigate between assistance ministry, Street Outreach, and our place. So it's been really good. And we're just we're going to do some fundraising soon for the rest of the remodel. Because in total, it's going to be about $420,000 for the whole thing once it's said and done. So we're just working on that and pushing along. We have a lot of people, and Street Outreach, they make sure to go in the morning to God's Love at 8 a.m. and then the library at 9. And then, of course, if anybody calls us and says they want to come down there, we go pick them up, and then we drop them back off at 3. So they have that ride from kind of distance. And then once our other side is done being built, we'll have telehealth and partner with PeerView, so that will kind of ease some of the having to go uptown or anywhere for medical appointments, case management, that kind of stuff. So that will be a big piece. But as of right now, PeerView is at our place every Thursday from 1 to 3, the mobile clinic, so they can access that thing. So, yeah.
That's great.
Yeah.
Thank you.
Yeah.
Thank you.
Hi, Colleen, go ahead.
Chair Feist and everyone assembled. I am looking at page 87 with the demographics. It looks like this is just for May. I'm wondering, is it possible to just get like this page of demographics from the start of funding until current, so that we can maybe update our one pager to show all the awesome stuff that's going on?
In for your presentation, Commissioner.
Oh, gosh.
Yeah.
Forgot about that already.
I won't let you.
Yeah, so you just want the demographics that she has in there for the
Yes.
whole time? Yeah, we can do that.
That'd be great.
I'll add to that. Thank you, Vice Chair Smith. That's a good point, is if you could do it by year also. So there's a conglomeration of it all, but then we can see where you have started and where you are now.
Yeah.
Yeah, because this is good and helpful, and the quantitative stuff is terrific, or the qualitative stuff is terrific, but the quantitative is great as well. So, anything else?
Not from here.
Okay. I have two a comment and a question. I appreciate the mention of rural outreach. Can you tell me what that looks like a little bit more, briefly?
Yes, so, I with the other state outreach, Caitlin, we go out, we've gone to Brim and I and explored up there, Cal State Sculch and up there. We've connected with the sheriffs, in Lincoln and and then East Helena as well. Gave them our contact information if they come across anybody that may be needing any kind of services there, to reach out to us and see if we can go connect with them. And then we've also talked with the forest ranger who goes out and gave him our contact as well.
Yeah.
So that we can pass out.
Thank you. I know I have harped on that since the start of this, so I appreciate that. And you reaching out and working with them to make sure that our rural communities in the county are reached too. And the second is more, I don't know if it's a question, you can answer it however you want to, but the safety of you driving folks. So 1,000 rides, it sounds like 1,000 successful rides. And understanding that some folks may have some underlying concerns and safety concerns. Do you have comments or anything about that, or how do you feel? Is it it's two of you that are giving those 1,000 rides?
Typically, yeah.
Yeah. And what do you feel any concerns? I don't know how to ask the question.
I know what you're saying. I typically don't. I think we do see a lot of people who may be like in some mental health, something going on or whatever it may be. I personally have never been like in fear for my safety when I've been driving them. I think people are pretty respectful once they like get in the van. They just kind of calm down a little
They
bit.
feel the safety of what you're trying to accomplish.
And I think we've had a few instances where maybe somebody was fighting with somebody else in the back of the van, and that's kind of like we'll pull over. And I think that's happened maybe twice. Pull over and assess the situation, see what's going on, and they were able to calm down before we continue on.
And someone always knows where you're going. Someone else always knows where you're going. So there's some safety precautions in place for you all as well.
Yeah, we're always in communication with Michaela and the staff at our place, and they always know where we're headed and when we get there and all that.
Okay. And I bring that up because if you are going to rural places and there may not be self-service in some places, just making sure that your safety is paramount as well. So, okay. I'm glad to hear that. And I think it's good. And it's a lot of them, not only the services and the people, but that many rides is a lot. So, good. Any other questions or comments? Okay. Well, thank you all very much. Appreciate the update. Carrie, thanks for joining us.
Behind the train, went
Oh.
the wrong way.
That train.
Yeah.
We will, I'll set a 5-minute timer for you too. You don't need to use it all, but we have your report and have had the opportunity to read it. But if you wouldn't mind giving us just a brief update, and then again, opportunity for questions for you as well.
Absolutely. Yeah. So thank you so much for having us here today. And I'm excited to be giving some updates on this really important project that for our organization, as you guys know, and looking at our objectives from the application, really what we're really working to do is increase accessibility to even knowing that our services are available and being able to initially inquire about them. That's a huge first step. And then the second component of that is once admission has been, a determination has been made and somebody's admitted to our programs, helping break down the barriers to actually physically getting them, physically, mentally, and emotionally being able to get them to be able to get to our program and access the services. I talked a lot about this in our application and our presentation, but substance use disorders are typically a symptom of some larger and more significant challenges, whether that's co-occurring with mental health. For us, with the women and the families that we serve, most of the time, while co-occurring is happening quite often, there's also a really big factor with domestic violence, lifetime exposure to trauma. Human trafficking is really continuing to see an uptick in exposure to that. And then just all of those things kind of wrap into living in a really chaotic environment, whether that's being on the streets or in trafficking or domestic violence situations, or often too young to be in a place where they can feel like they can be making some of those decisions independently. I can't remember if I shared this when we were here doing the application, but there's some really interesting dynamics in somebody under the age of 18, between the ages of 16 and 18, their ability to place themselves in residential treatment programs. They actually can if they hit a certain number of things. One of those being if they're married, which you can legally in Montana be married at 16. But the other being if you're pregnant or parenting, you then have the legal right to be able to access residential services on your own without being emancipated, without needing a lot of other things. That's not always immediately known. And so those are kind of just some of those challenges, the really complex challenges when you look on the surface and you say there are, some women with children that are really struggling with these things and there are services available. How hard is it to get from point A to point B? And so we're really working to break down those barriers that get between point A and point B. So the couple of they sound pretty straightforward objectives, and some of them really were to create a user-friendly inquiry and application process. That was still a little bit cumbersome for us. You could access a lot of that information, but you couldn't quite finish the application without at some point getting things printed, getting a wet signature on them, somehow getting them back to us. We, in December, were able to get all of that project finished. So all of our application now is online, which is proving to be a really great increase in accessibility. So what we see from inquiry to actual application has gone up. Not seeing those incomplete applications that are coming through, which just speeds up that process initially. So that's working really well. Folks, a lot of times do have access to a phone, or they can get to the library to get onto a computer. So having that completely online now has helped tremendously. The second part that we were looking at is developing a tracking system within our EHR that really helped us collect data, one, and two, helped us track how many inquiries we were getting and how the follow-up was going. So we get most of our inquiries come in usually in the middle of the night, either by phone or in our inquiry section of our website, usually in chaos. And then they can be really hard to pin down because it was a moment in time. So we were really struggling to have a tracking system that actually helped us track when the last time we'd heard from them, where that initial inquiry was coming from. We can literally now, with some of the new systems we're using, we can pinpoint, did that come from a phone? Did that come from a computer? Sounds a little creepy, like we're really tracking people, but it's really helpful to understand the situation. And then setting up alerts on our end when you're getting, 80 to 100 inquiries in a month, really making sure that we're not letting anyone slip through the cracks and not waiting for them to call us back once we reach out to them. So we thought we would be able to do all of that in our current EHR system, our electronic health record. What this process has actually helped us determine is that we don't have the right EHR system for a lot of different reasons. This kind of tipped the scales. So we're actually in the process of redoing or getting a new EHR system, which we will start implementing in September. It's much better for doing what we do for the size of our organization, working in behavioral health versus just medical. And a really nice factor is it integrates really well with what's called the Big Sky Referral Network, which is actually the statewide referral network that for behavioral health. And we feel like that's going to be a really important component, not just, serving obviously outside of the county when we can, but also getting referrals when they're in our residential program out to where they need to be. So we are working on that. In the interim, our new admissions coordinator has done a fabulous job of setting all of this up, pulling data out of our EHR, getting it into a Power BI Excel spreadsheet where it is doing some of that tracking, a little more manual than we want to be right now, but it's achieving the goal. And just her work in that and just our admission coordinator's dedication to it. We have seen some really great increases already. So we've had from November to May, we had 56 inquiries for residential programs only. 30 of those inquiries turned into full applications, so 54% of our inquiries, and then 11 intakes occurring from those, so a 37% application to admission, which is really good numbers that we want to see. We want to see those a little closer to 60-40 is where we would want to be. So we're getting there. Of the 11 that got accepted, this kind of talks about the other piece, only 2 did not actually make it to our program. We were seeing closer to just the 3 months prior to our application, we had 3 clients accepted that didn't make it to our program just in those prior 3 months, not even collecting the data all the way back to the year. So where we're really finding that changing is the change in being able to fully fund that admissions coordinator position and the case management, fund the side of case management that gets them in the door before we can actually start billing for case management. That all has to happen once they're inside the walls. So the work that they have been able to do in helping these women navigate really dangerous situations, being able to get them hooked up with the police when they need to say, I'm leaving now, and the police patrol being able to be in the area. I mean, it's really complicated things that need to happen, sometimes helping them navigate those underage scenarios where they're thinking that they can't be able to be admitted on their own without a signature from an adult. Just navigating all of those pieces of it we've seen a really a huge decrease in those admissions that don't turn into actual heads in beds. We've also seen a little bit of an increase in number of moms that are able to more quickly reunify with their kids once they get in there, because we kind of pulled those pieces together, got CPS involved at the very beginning of, hey, they've been admitted, let's start that clock. They're going to be in here, they're going to be settled. So it's shortening that time of reunification. So, and that is just that intangible, on the ground, dedicated staff when they're needed to be able to do it. That is that part that goes unfunded in this great big treatment, kind of mental health and substance use space. Sometimes it is just, and you guys know this in street outreach, sometimes it is just the human to human connection to say, I'm going to get you from point A to point B. I'm going to help you break down those barriers. So we've seen a great increase in that. I'm excited to just keep collecting that data. Our admissions coordinator also happens to be an absolute guru in data collection. I don't know how you get that combination of people. And then in terms of just, engaging in the substance use provider population in our county, our clinical director, Daniel, has been, he has been on the Strong Roots Coalition for Substance Misuse here in the county, and he's been a member of that for a while. And I don't know if you guys know much about the coalition, but it's set up to improve the substance use continuum of services, prevention, early intervention, treatment, and recovery by bringing partners together to alleviate gaps in Lewis and Clark County. So he's mainstay member on that committee, which has proven to be really, really helpful. I think we will start transitioning our clinical supervisor, Kendall, more onto that. She's there from time to time, but I think we will do that. And then I've been able to spend a little bit more time with some of the legislators, just at the state level, looking at the HEART initiative funds and how we might be able to bring more of those funds down into the communities as it relates to women and children and families. They have a small piece of that, but really been trying to work with them to bring more funding down into that level. Got off a call today, and the substance use prevention block grant looks like they're going to be doing something really specific for women and children, which is really exciting. So, but that just takes a lot of on the ground, meet in the coffee shop outside of the session, ask questions, give them data, doing some of that. So we've been really grateful to be able to use some of this funding to spend time with those folks. And I think we're gonna see some things moving in that direction this year, which is really important given kind of what's happening with Medicaid funding and stuff. So it's nice to be getting a little bit ahead. So that's kind of the big picture. I am happy to answer specific questions, or excited for the 1 year mark when we can really give you guys some solid data points. Snapshot for now.
Thank you.
Mm-hmm.
Vice Chair Smith, Mayor, Commissioner, do you have questions, comments for Florence Critton?
I just am very impressed by the work, and I think connecting people from here's the challenges to here's how we break down those barriers. I mean, we see it everywhere. And so, I'm glad to, see that this is being able to help kind of give you the resources you need to
It really is.
address those.
Yeah, it really is. I should also mention, that one of the things that we're working to do now that we've got some things established is, working to get back out into Lincoln and Augusta. So we actually have some pretty good connections up there through our community-based services, because our home visiting reaches as far as those counties, and our home visitors have gotten some really good connections. Those communities tend to be, as everyone knows, really closed off and very much a sense of self up there, and that like, we got this is our community, but they're hurting for resources. And I think we're in a place now that we can utilize the connections Jen and her team have made up there through the school and kind of the school nurse and the library to start getting some more information up there. And I think you do have to just become a friendly face in those places, and having the time to do that is going to be really important. So I think we've talked that that's our kind of next step into that, reaching into the community a little more.
Great. Appreciate you mentioning that.
Yeah.
Vice Chair Smith.
Yes, I have two questions. One would be on the demographics, and I realize you work with, younger women, but even if we could get a breakdown of how many underage and then how many that are of age, that might be a great way to do that. And then, I just have a question. You mentioned the Big Sky referral system. Is that the Connect referral system, or is this something new?
So it's interrelated. Yes. So the Connect systems, Connect is connected into Big Sky Referral. Big Sky Referral is really focused on wide range behavioral health. So if you were in psychiatric services, it's a little bit more of the behavioral health side of it. It doesn't do as much of the connections in like the housing, homeless, that kind of front door stuff, but it connects folks in that behavioral health world. However, if I'm understanding it correctly, we're not in Big Sky Referral right now because we don't have the right system to be in it. If I'm understanding correctly, there is a way to connect into Big Sky Referral. Mm-hmm. So yeah, that's a great question. And I'm anxious to be able to share more with you guys as we get more dialed into that system. But the idea is they are all supposed to be starting to work together with each other.
Oh, what a novel idea.
Yeah, right? Crazy. The nice thing is the state of Montana too, DPHS is actually recognizing Big Sky Care Connect as an actual referral hub, which is really, really helpful. If they're not on board with it, it makes things really difficult. So yeah.
With demographics for the 1-year report, if it's possible to indicate without divulging personal information, how many folks are being treated for opioid use disorder? I know that we felt this grant application was compelling enough to fund it, but of course, everything we do ties back to opioid use disorder and making sure that we're working within that. And so to know, and hopefully to share if that's been helping some of your clients. So.
Yep, no problem. Do you guys want to see that for now or just in the 1-year report?
I don't think it hurts if you have it now, but at least in the 1-year report.
Both the age of our referrals and so age of referrals and admissions, mm-hmm. and then which ones are specific for treatment of opioid. Mm-hmm. Yep, you got it.
And then with that, if you have any of those successes if you could ever tie that to show how this funding was beneficial directly for that piece of it, okay. That getting them through the process faster, got them into treatment faster, which got them stable,
right.
That would be terrific to know. And I'm not asking you to directly do that, right. But if that was something that you could tie, I think that would be helpful.
That's great information for us to know, because that's something Haley can be working on building, because for anyone that has gotten into the program in the last 6 months, we've only got very initial data on their actual mm-hmm. treatments because it's an 18-month program. So, but if that's something we can absolutely be building into I can have her start collecting data on what that looked like at intake, admission and intake, and then what that's looking like in the long term.
And I would only imagine that it would help with your substance use block grant application to have that information on it too. So
The stuff, that we're really excited to be building out. It's great information. I mean, obviously it informs all of our treatment as well. I always say one of the best things we did was start our transitional living program because it helped us understand what we weren't getting right during treatment because we were watching what happened when they moved into the community. I mean, they were short, but it really helped inform. So I think this is the kind of data that helps inform our treatment as well. So absolutely. Yep. I'll get everything I can pull together for what we've done so far in 6 months and then know that that's what we'll be building towards at the 12 month.
thank you.
Absolutely. Yeah. You got it.
Any others? You're still off mute. Vice Chair.
I have nothing. Thank
Okay.
you.
I thought maybe. Either of you?
Yeah, good conversation.
Yeah, appreciate all of what your organizations are doing and the three of you joining us today. So thank you. So nothing to adopt with that, just a status update. So appreciate all of the information and conversation for sure. So thank you. All right, the next piece that we have is our NOFA, our Notice of Funding Availability. We have a September 1st deadline for the second round of applications, and thank you both for putting together what you have. You two are so great about keeping it all together. And we funded quite a bit, a little ahead of time, so that money next week, week after, can go right out the door as soon as possible for the approved grants. We left ourselves with not very much for the end of the year, which we kind of assumed a little less than half. But I take that as a win that we're getting money out the door that much faster and hopefully making an impact instead of holding on to it, hoping we would make an impact in the future. But with that, with the NOFA, going through it, their funding priorities, the eligibility requirements, application details, deadlines, and then reporting. Comments, questions about the NOFA? Any thoughts on it? Updates? I have one potentially, but wanted to hear from folks otherwise. Vice Chair Smith?
I don't have anything. Thank you.
Okay.
I just had a question in terms of pushing it this. I mean, I think all the organizations that have been consistently involved in some of these conversations are aware. One of the areas that I think that it might be helpful for the community to understand the actions that we are all taking to try to combat some of these issues, thankfully through these funds. I'm just wondering if there's a way to be able to like promote or talk about the fact that this is out there. Not necessarily, I think everyone who wants to apply is fairly aware, but for those who are invested in the issues, to understand that there are actions being taken. I don't know if you guys have any thoughts about that, but I do think that the more that we can kind of start talking about all of the things that are happening might be helpful.
Couple things I have thoughts of that. Is if we could get a press release that's sent out to the news, and that I would include, and I don't know what the process is for the county or the city of Helena, but making sure that MT43 News and the East Helena Monitor and the Lincoln has a news paper, I think, a newsletter that goes out. I don't know what the proper term would be.
Used to be the Blackfoot
Valley Dispatch
Yeah.
essentially shut down.
Oh, is it?
Nobody took that on.
They went to online and they couldn't sell.
But at least for those papers, including the IR and hopefully Montana Free Press, to pick up what we have done, a reminder of and of what those look like, and then what we have left for this year. And that we will be doing it again in the spring.
Yeah.
So that it's not like, oh, well, it's just this amount for the fall. And then the perception to be that it's done. that's one. And I think that if there's then a press release, maybe we then do our due diligence to try and
Yep.
promote that. And Vice Chair Smith and I did do a Kiwanis presentation. Commissioner Huntenhausen will hopefully be doing this conference in July. Or Mayor Dean, one of the two of you can arm wrestle for it.
The presentation you're doing.
I'm on to you now.
Yeah.
But trying to promote it in various ways. Hometown Helena, bringing it up again, kind of those pieces. But that press release is usually the best way for me to share it.
Because I'm doing a work training, so that is
I tried to say I was shampooing my cat, but it didn't fly.
didn't work.
Commissioner Hunthausen, we've been invited to speak at that as a panel member as well.
Oh.
So.
Would you have the availability to mention this
Absolutely.
funding and that we encourage
Yeah, it's is it the state wide?
July 15th?
The substance.
I can't remember the exact term.
No, I have to go.
Substance use disorder task force.
Use order task force.
I think that might be the one I just got invited to speak, and I was supposed to be speaking about being
Oh,
a recipient of this funding.
Okay.
So I don't know any more details other than I said,
Yeah.
because I'd be happy to speak at that.
Good.
good.
I
Yeah, I think
will wait for instruction as well and just do my best.
And on that,
Okay.
Vice Chair Smith, I mentioned, and I can start working on it to Commissioner Hunthausen, that we have that presentation as a template.
Mhm.
Update it for him to use.
Okay. Do you want me to, do you have it? Do you want to send it to him?
Yeah,
Or do you-
I have the one that we presented. Do I have the most updated one? I'm trying to remember. I think we made some adjustments to it.
Oh, I did.
Wouldn't
I'll
mind
just,
sending it
I'll
to all
send
of
it.
us. Yeah.
Sure.
we can
Yep,
look at
we
it.
can do that. Or do you want me to send it to Eliza and she can send it out?
Sure, that's probably the most.
I don't want to get in trouble for, talking more than one person.
I agree with you. I think there's a lot more I want to do. So, and maybe some of the small papers may be more inclined to write an article about it. So with the NOFA otherwise, that'll be a big part of that press release. The amount of funding, the funding that we will hopefully have, and the planned amount that would be open 2027. And the only other thought I had is we have talked about it. I don't know that we've formally agreed to it, and we've gotten applications for it. And then we've come back to the same conversation, which is trying not that the goal is not for ongoing operational expenses. I don't know if we want to formalize that more in there because it's not formalized in there, or we don't because we don't know what the future holds. What are your all thoughts on that?
Mr. Chair, I think it's important to
Yes.
at least make folks aware, because I think if someone was counting on this for ongoing funding, it's not going to be there forever.
Mhm.
And at least at the same level.
And
that's
we
not the
mentioned-
intent, right? So
And we mentioned the 1-year funding and multi-year not an option, but something to the effect of, and that's where I was hoping to wordsmith here today, was the intention is not for ongoing operational expenses, but I also don't know if we want to flat out say we're not allowing that, because I don't want somebody to also feel like they think that that's what their request is and it really isn't, that we can still take it, but that there's some understanding of that.
I don't know if I necessarily have specific language, but I mean, it might even be just around, because I'm not opposed to like providing a bridge to like folks finding or creating long-term sustainable funding. I know at the city right now, we're having to have some of those really hard conversations because it's a very rough budget year. Like, we often provide support, even if it is supposed to be one time only. If you continue to do it, it makes it that much more difficult if people start relying on it explicitly. But maybe around just the fact that if you are, I wonder if it's something around if you are requesting for some sort of operational expenses that you include in your application. like
Transition,
a transition or off ramp.
a detailed transition plan would be
To
necessary.
sustainable or,
I just want to have something.
program end, I mean, sometimes programs run their course too, and then you decide to move on to something else. So I mean, at least that you're not falling off a cliff.
Chair Feist.
Articulate.
Yes, ma'am.
In the NOFA, it does say focus on building sustainable systems and strengthening long-term local capacity. So, I mean, that kind of addresses that it's not too,
And I read that section along with the rest, but I don't know that someone would understand that the goal is not for is more direct of the intention is not for ongoing operational expenses. And maybe that's where it could be put is
right.
the intention is not for ongoing operational expenses. The focus is on building sustainable systems. What would you all feel about updating that to be clearer? And is that type of language okay?
Yeah, I think so. I mean, I think the idea is more like it's the startup or implementation to stabilize and then find if you are using it for operational. It's not. I think explicitly noting what the intention is fine.
So would you all feel, and maybe we could vote on that part to formalize it more because we voted on the NOFA in the first place, is then verbiage of that last bullet under eligible programs and initiatives must have, or so I'm trying to think of it in the grammatical way then. A focus on building, and then so maybe focus on building sustainable systems, and then that sentence, and then a new sentence, the intention is not for ongoing operational expenses.
but that doesn't fit under the bullet point that's under eligible programs and initiatives must.
Well, then it would remain as focus on building sustainable systems, and then period, and then that next sentence that the intention is not for. Does that make sense? No.
Yes. No, it does, but I'm just wondering if we need to reword the eligible programs and initiatives must. Because then we say it must, not be long-term operational? I don't know. I'd say throw it into AI and see what comes up.
Mr. Chair, yeah, I think that as long as we all agree on the intent, that we can work on the language and awful.
Okay, I just wanted to, if everyone was comfortable voting on that, then I just don't want folks to, number one, get their hopes up. Number two, be waiting on like paying a bill because they're hoping that they could use the funding. And then we take our time to review the applications, and then we tell them no, because your application wasn't really the intention in the first place. Right. So,
yeah, no, I get it. I agree with the intent for sure.
But I don't want to be too explicit that we wouldn't accept other things like the program that you all are doing. It's operational, but it's yours is they're all operational, but so let's wordsmith that. Okay. Do you all feel comfortable, and is there a motion to amend that eligible programs and initiatives must to include language that with the intention of clarifying the intention for limiting operational expenses?
So moved.
Terrible motion too.
Second.
Okay.
No, you're good.
All those in favor?
Aye.
Aye. All right. And then you will be sending out that information to, or have the city then, or the county put together a press release?
Yes, Chair, what we can do, Nancy and I can work on a press release,
Okay.
work with Amanda and the city on what that looks like, to send out to you all for review.
Great.
And then we can get that through different channels. And in terms of the NOFA, what we'll do is I will wordsmith that language a little bit, get it out to all of you just to make sure that sounds okay to
Okay.
finalize that with the intent that of the motion that I'll have to listen to the recording to actually.
Hey, I'm sorry and thank you. All right. Any public comment at this point? Or any questions I shouldn't ask that, or any other questions or comments about the NOFA? Okay. Any public comment for the sake of the meeting? No one online, Nancy, is that correct?
No, cool.
Okay.
Can
No,
I
no one else online.
insert something into the agenda?
Yes, ma'am.
Where do we stand with getting one more member?
Yeah. Oh, that was, did I skip that?
Yeah.
Oh my gosh.
I was gonna ask, thanks.
Sorry. We'll go back. Number 4, status of a new committee member. I talked with Nancy and Eliza this when we got in here today, and there have been a couple of inquiries. One asked, but mentioned or asked the question if they had to reside in the city limits, and for that role, yes, they do. And then didn't hear anything back, so the assumption is maybe they don't. But we are still looking for, which is a good point, because I think maybe in the press release, we could mention that we're seeking a new member who lives within the city limits of Helena. And otherwise, there was one other possible inquiry, but no bites on that either. So I think it's up to us to start mentioning it and reaching out. I was going to reach out to someone and ask her if she could use her web of folks in the realm of mental health and substance use prevention and treatment to help. Do you have any updates?
It's just, it's not one of the specialized seats. It's just someone.
That lives in the city of Helena, a member of the public that lives in the city limits of Helena.
I do know we've included in the last couple of our advisory board openings, press releases. So
maybe once they see what's happened,
that's
they'll be more
yeah.
interested.
Yeah.
And we could use that as kind of our marketing tool too. Did you have an update yourself or just asking?
No, yeah, just asking. I threw it out to a couple people and then realized that it had to be a city person. So darn it, because either one of them would have been fantastic.
And you're in the county, correct?
Yes.
Okay. I was gonna say we could switch you and then open it up to the county, but okay.
And the one that contacted me was from the hospital. But I think the hospital's in the city, but I think a lot of their employees probably don't live in the city.
So we have been having a conversation about like some of the advisory boards that have I'll use like the TIF board, for example. Their business is within a TIF district, but they do not, or they're like an employee, they're representative of a business that's in the city, but they don't live in the city. And for city boards, we've been kind of saying at the discretion of the mayor for some of them, because but great board members and like their vested interest is through the business. But since this is a state program,
well,
do we know if
you bring up a good point, because I happen to know the mayor of Helena, and they helped make some of the decisions of how this was crafted originally. You would have to go back to how the city and county determined this. And I would say that that's probably a good point, that if you felt
my preference is like that representation is there, but if it's like, someone is a representative of an organization that is in the city. So I mean, I think
so the commission would have to determine if how it was
for
created.
Most of these, we go back to the establishing resolution. Some of them have wiggle room in there.
I do think this one explicitly says someone
resident of,
and period.
Yeah.
There's plenty of people living in the city.
There are, and plenty of people who are interested. I think it's just a matter of
contribute so we can.
It's funny. It's been a lot of the boards that our fund and you get to determine dollars that you're struggling with.
Do you have that resolution in front of you?
You think people feel like that's too much comparison?
Yeah.
And it says for membership, a community member that resides in the
Yes.
city of Helena, appointed by the city of Helena's mayor.
Yeah.
Or
We will-
representative.
Do you all feel compelled enough that if, well, I mean, that would be up to the city. It's not even up to us. I think that if we've had the same conversation, we're in East Town and we are exploring amending our zoning board to allow business owners that don't reside in the city limits to be a part of that, because we have a couple that want to, but they don't live in
Yeah.
the city limits, so they can't. But I think would be, obviously they have very vested interest and pay taxes and do all the things. So if you all felt compelled, I would think that that's a good idea, especially if someone was with an organization that has a big impact in this industry in the Helena area and wants to participate. Or in the
I'll
city.
do, I think what we'll do is when we do the next round of promotions, which is I think next week, I'll just ask that we really emphasize this one and maybe if we could get some of the, I mean, Amanda's obviously very well aware of what this committee does, but if you guys might be able to get her some of the like recent updates, and then we can get her to do a social media post specifically on this one.
That would be good.
Yeah. That's
Chair, Mayor Dean, we can certainly, using Vice Chair Smith's report and then some additional information, we can certainly get Amanda information for that.
okay.
Cool. Sorry to skip that. It is very important. So thank you for bringing me back to it. And then you'll think about if you wanted to update that after the fact. But for
Yeah.
now, we'll leave it
I
as.
think that, so that's part of kind of the broader conversation that we're having, so I'll probably group it in that.
Okay.
We're trying not to do one-offs too often, but I'll include that in the conversation we're having.
Thank you. Any other thoughts or comments on the status of a new committee member and outreach efforts? Okay. Then we'll fast forward back to public comment. Is there any public comment on the agenda as it stands? Or otherwise? Yes?
Just one thing, under public comment, when you guys were talking about the application piece of it, and just because we're in the middle of this right now, one idea is that, so the Montana Healthcare Foundation, it's a very similar thing, came from a huge pot of money, they've gone over the years of how they're gonna dole that out. And one of the things they do that I think is really neat that helps without that cliff, and when you're working on a project that usually the projects are kind of operationalized, they do a 1-year planning grant, and then you can apply for after that a 2-year implementation grant. So if we're working on a project, it's capped at 3 years of funding, but it's all within the same project, and it's very specific. The first part of it is really about kind of getting your ducks in a row and making sure that what you're doing is going to make sense. And sometimes that's staff people and data and all of those things. And then you, if you're successful with that, then you have opportunity. Not everyone that gets a planning grant gets an implementation grant, but it's just, I don't know, it's a cool way of doing it. And we've used it a couple of times to launch. It's how we launched our recovery home. Actually doing it with a maternity home right now with some pieces. So it's a neat concept because going into it, the max you're getting is 3 years. It's very specific about being planful and then implementing to a place where there's sustainability. So I just wanted to throw that out because I'm in the middle of it. Just, something about it.
Sure. And if any of you have interest in that between now and our next meeting, which will be in October, that would be good to mention. And then we could talk about it on the agenda for the next meeting.
Well, maybe while you guys are wordsmithing that piece, I mean, if there's language that they're using that we might be able to borrow.
Yeah, and that could be definitely up for more conversation if you felt compelled for future. Right now we're at, how many years do we have kind of a guarantee of this? One more for sure. And then probably more, but we have, at least we know one more. I don't remember where that is in here. So something to keep in mind for that as well, should we keep going and we'll be looking into that at our next meeting as well, if I'm not mistaken, of who the next chair of this committee will be for 2027.
That's correct.
Yes.
Thought that was a permanent.
Yeah, I thought.
It was a 2-year too, so. All right, well, if there's no other public comment, thank you for your public comment, Carrie. I will adjourn this meeting unless you want to determine when our next meeting will be, which is sometimes helpful when we're all sitting here. Do you want to determine when our next meeting will be before we adjourn? Sure.
Yeah.
I like that option. So go ahead.
Chair,
Yes.
let me look at the moat. So the deadline for the fall is September 1st. You will all need time
For
to
us.
review those for us. It needs to go to the moat 2 weeks prior to their fall meeting. So let me just check. I have their fall meeting dates. Let me just check to see what those are.
Is that on their website? You don't need to answer that if you happen to know.
It was.
I thought it was too, but I don't remember where.
Week is League of Cities and Towns.
It is
It's later in October.
it's
Oh, it's in
October,
October, okay.
no, it's October 7th, 8th, and 9th.
Chair, their meeting is Tuesday, October 21st.
Okay. So it'll be right during the League of Cities and Towns.
Which is in Helena though.
Yeah, that is true.
And a Monday in there somewhere. That
Yeah.
works for everybody. It's like it.
Mhm.
Noon was great for me.
Monday, October 5th is where that would put us then. No, we go back even further because we typically meet, we have all the presentations, we then give ourselves time to review and then make the decision.
To make the decision.
Yeah, the 5th.
Chair, we would have to have the decision to the moat by October
7th.
7th.
So if we could have the 1 hour online meeting on the 5th at noon, does that work for folks?
Yep.
Yep.
You said noon does work best. Okay. And then from there, because we have September 1st, like September 14th, kind of giving ourselves a little bit more time than we normally do, but I'm okay with that. So September 14th, it would be the 2-hour presentation, consideration, all of those. Also at noon.
That's possible. It works really great schedule. So
Commissioner?
I think so. I think the next week is the Mako conference.
Oh,
okay.
But it's here as well. So
Oh. Everything's in Helena right now, which is
We're
fine.
trying to get the league back here in 2 years too, so.
ours just happens to be the rotation.
Oh, yeah.
Oh, is it?
Oh, before a legislative session.
Well, legislative session, the winter conference is always on legislative years. It's in Helena, and then it rotates. But the other one, our fall conference rotates. It's in Helena.
Don't have the date yet. Can't find the date for the 26th.
Mako,
Yeah.
27th, September 27th
Oh,
through
there you
30th.
go. Yep.
Thank you.
As you said it, I just found it.
September 14th, the big application meeting.
Noon to 2, and then noon to 1 for the October 5th meeting. And just online. Not the one on the 14th. Okay. Vice Chair Smith, you're okay with those dates?
Yes.
Terrific. Sold. All right. And at exactly 1 o'clock, unless there's any other comment, I will adjourn the meeting.
Man.
Okay. Thank you all.
Thank you.
For all you do.
If either of you know people who might be interested in serving on the city, yeah, let us know.
I was gonna go step for the Indian live in the city.
Yeah.
Vote.
Start with that.
It's, our organization is on the city commission.